Hello everyone, my name is Navdeep and I'm a registered nurse currently working as a district nurse at one of the community service providers in Victoria, Melbourne. I'm going to present a very interesting topic of how to monitor blood glucose levels using flash glucose sensors today. This is not a very new topic for most of my colleagues, but the purpose of making this presentation is for someone who hasn't come across this technology yet, or if some new students are coming on placements or a new graduate is joining into the nursing profession and this technology may be very new for them to understand. So without wasting much time, let's turn off the light and let's focus on the presentation. So this is flash glucose monitoring or blood glucose monitoring using some continuous techniques. So we'll look at some different scenarios. So this is a 62 years old person named John who works in a multinational company, and he often forgets to check his blood sugar levels. So because he has no time to bring out those little tiny strips and put them into the BGL machine and then prick himself, he has got no time to do all that. And that's causing his blood sugar levels to go all over the place. He is getting frequent hypos, he is getting frequent hyperglycemias, and this is one scenario where we can think of something like we need some flash glucose or continuous glucose monitoring to monitor the blood sugar levels. Scenario 2 is a 72 years old lady, or a male or a female here, with rheumatoid arthritis, and he or she has got some deformities of the hand. So as you know, for checking blood glucose levels, we need to have really good coordination of the fingers. And if someone has arthritis, or there is another example, like someone with Parkinson's, they do not have enough good hand coordination or restricted hand coordination because of the joint deformity in arthritis and tremors in Parkinson's. So this is another scenario where we can think of something like a flash glucose monitoring technique. Another scenario, a 68 years old person has got highly unstable blood sugar levels and maybe on multiple anti-diabetic medications. So in this kind of scenario also, we cannot really rely on one-off finger prick. We need to think about some continuous or flash glucose monitoring. So as you can see, this slide is a gist of all these three scenarios that we discussed. So what we have seen in all these three scenarios is a common problem, which was difficulty monitoring blood sugar levels, because in first scenario, this person was too busy to do these finger pricks. Second scenario was difficulty with the hand coordination because of arthritis. And third was really unstable blood glucose levels all over the place. So what actually flash glucose monitoring is? It is a technology in which we use a sensor, and a sensor is put on the arm. Usually it is the back of the forearm or the upper arm, and the glucose levels in the fluid are measured by the interstitial fluid or fluid around the cells. So here, blood is not being utilized to measure the glucose levels. So what this sensor is using is, it is using the interstitial fluid or the fluid around the cells to measure the blood glucose levels. This sensor lasts for 14 days and it needs to be replaced every 14 days. The application of the sensor, as you can see, is very easy. It comes with an applicator, and all you have to do is take it out of the box, put the sensor into the applicator and just whack it onto the person's arm, and you get some readings. If you download the reports, if you can download the readings of this sensor using the reader, as you have seen in this slide, this is the reader that comes with the sensor. So as you bring the reader closer to the sensor and you allow it to read, or you just swipe the sensor, and this reader gives you a result of what the blood sugar level is. And this reader can be connected to your computer or your laptop, and you can download the results, and the results look something like this. So you can see different patterns of blood glucose levels. You can see a graph. You can set some target ranges, and you can easily see if your graph is going out of those target blood glucose levels. That helps to identify what time of the day it has gone up, what time of the day it has gone down, and you can monitor the glucose levels continuously for 14 days. So that's what the beauty of this sensor is. And you can download these reports for all 14 days. You can share those reports with the client's endocrinologist, diabetes educator, general practitioner, etc. But there are some very important points here to remember. First one, that it is not a replacement for traditional methods of finger pricking. We still need to do finger pricks in certain circumstances. These are like when blood sugars are going too low, if the person is getting a hypoglycemia, and if the person is getting a hyperglycemia. Hypo, in Australia we measure it in millimoles per liter. So hypoglycemia reading that's considered in Australia is less than 4 or 4 millimoles per liter. And then hyper, mostly it is if 15 or more than 15 for most clients, but sometimes it can be 20 based on how their glycemic control is. So when you put the sensor on the arm, it takes 60 minutes for it to start. It won't start straight away. So for those 60 minutes, you still need to utilize finger pricks to check blood glucose levels, because sensors don't work straight away. It will take 60 minutes, like I said, to start. And again, the sensor readers are used to start the sensors when they are put on the arm. Sometimes, as it's a technology, it can fall off because it's got an adhesive layer underneath. That's how it sticks on the arm. And if that adhesive layer goes weak for some reason, if the client has got too much moisturizer on the arm before you have put the sensor on, that's why they come with alcohol prep pads within the box. So you always rub alcohol prep pad nicely and let it dry before you apply the sensor. Otherwise, the sensor may fall off. So if the sensor has fallen off for some reason, or if there is any other technical issue that has come up with the sensor, in that case also you have to go back to finger pricks. So it is not an alternative, it is just an adjuvant or an adjunct, you can say, to the traditional finger pricking method of checking blood glucose.